so much. Lieutenant Governor Brown, it's great to have you as always in Montgomery County. We see you here a lot, and we appreciate that. Secretary Sharpstein, you're a superb leader for health policy in our state. We're so proud of what you're doing to be out in front and implementing federal health reform and all of the other leadership that you provide to make Maryland the healthiest state in America. I don't want to just repeat the statistics that my friends Uma and Valerie gave you, but you know, we're a really big county. The rest of the state thinks of us as a rich county, and we have some rich people, but we're a big county. We have a lot of people. We have almost 1 million people. Big county, big resources, big problems. 122,000 people without health insurance. A majority of Maryland counties don't even have 122,000 people living in them. 59,387 Montgomery County residents in poverty. 9 Maryland counties don't even have 59,000 people living in them. Big county, big problems, big resources. We have an extraordinary network of clinics that this year will serve 30,000 patients without health insurance, with county resources. No help so far from the feds, no help so far from the states. Thank God for the Supreme Court, because now the feds are going to step in and help. And thank you, Lieutenant Governor Brown, because I'm confident that with this Health Enterprise Zone program, the state will now step in and help. When I spoke with Uma earlier today about what should I say, should we talk about the clinic? Should we talk about our extraordinary leadership and how much we care about providing health for the uninsured? We decided, you know, maybe we shouldn't, because maybe Secretary Sharpstein, Lieutenant Governor Brown, they'll get the wrong impression. They'll think we've already fixed this problem here in Montgomery County. Maybe we ought to spend the money somewhere else. But I just want to tell you a couple of stories real quickly about one of our Montgomery Cares providers. On a Tuesday in September, Monica came to the clinic complaining of severe abdominal pain. The examining physician knew he needed an ultrasound and ordered one from a radiology partner. They scheduled Monica for the next day, and they confirmed that she had acute cholecystitis, a severe inflammation of the gallbladder. She was referred to an area hospital where she was provided with surgery completely free of charge through the referral network in Montgomery Cares. And the next day she was released from the hospital free from pain and able to rejoin her husband and son and resume her normal lifestyle. Fred is a 45-year-old father of 3 with diabetes. He was unable to work. He had inflammation in his right leg. He already suffered from neuropathy because of his diabetes. He couldn't feel in his fingers and toes. But he was sent to a podiatrist through our specialty care network. The podiatrist found Fred had a small fracture in his foot, and a diagnosis of Charcot foot led to Fred being treated by the clinic's orthopedist. 6 months of treatment, Fred was unable to work, but now his pain is over. He's able to walk, he's able to wear his regular shoes, and he's able to support his family. If not for this participating clinic, and we have several of our participating clinics here, both of these patients would have been seen in the emergency room at enormous cost to who? To the state of Maryland. But because of Montgomery County's ability to treat these people rapidly, no cost to the state, no cost to the patient. So what I'm here to say is, yes, we're going to treat 30,000 patients this year out of 122,000 without health insurance. But Lieutenant Governor Brown, when we talk about making sure a program works, we know how to do that here. There will be other jurisdictions that are not as far along as we. And of course, they should get grants too, but they'll be starting from zero. A lot of startup expense, a lot of overhead necessary, hiring docs. We're ready to go. You put money into healthcare for the uninsured in Montgomery County, we can treat patients tomorrow. We can get good outcomes for sure and measure the incidence and measure the outcomes and make it work. We'll make it work for you.